And now, I would say something completely different. Mr. Cameron Brooks from IBM Watson Group is giving the next presentation. He's the director of the Public Sector Solutions. His professional background is electrical engineering. So please, Cameron, you have the floor.
Thank you. So, thank you for having me. Thank you, Mr. Chairman. I appreciate the opportunity to address the EFSA forum today. So I'm going to talk a little bit about what's called cognitive computing, machine learning, maybe artificial intelligence, scary stuff, right? That's what Hollywood would let us think, with all the negative side effects of this that have been in the movies ever since, the Terminator, right? Skynet. But I think what we'll see is that many industries can't afford not to take a look at this kind of technology. Oxford says that there's a greater chance that, it'll lead to a disruption within so many information-intensive industries. And for Gartner, the risk of not investing is much greater than the risk of investing in this kind of technology. So let's think about this. I'm not an expert in an open risk assessment. I've been collaborating a little bit on this talk with a colleague from Deloitte, Hilde van de Velde, who's worked with EFSA. And so she gave me this chart just to talk a little bit about all of the challenges and how they're related to data and decision making. First around openness and transparency, and the full visibility needed in making decisions, especially governments, how to communicate the processes, questions about transparency, so where is the data, how to show it. In the case of independence, the decision making is subjective. So how do you show the evidence? Where is the proof that nothing was missed? Maybe some information is out there, but it was not found in making the decision. How do you show that, or show the opposite? For scientific excellence, there's a lot of focus on rules and evidence and the methods, and making sure that all the information is done in a literature review, for example. But again, how are you going to make sure that all of that is captured? We saw from the previous speaker new methods of capturing that knowledge, but there's so much out there that we have to make sure it's all looked at. And finally, in responsiveness, the speedy decisions. You have to do all these quicker than ever before, with new opportunities for food and drugs. So how do you move from reactive to proactive, predictive? This all comes down to really data and expertise, and how the two come together in order for many processes, not just risk assessment. So let me introduce Watson, and I'm beginning this part not with a picture of technology, but a picture of people, because it really is about people making decisions, professionals. So whether you're a chef or a financial advisor, a law enforcement officer, biochemist, you are more and more faced with decision making in the midst of unparalleled amounts of data coming at you from every direction. And it's really about the time and scale. Do you have time to make the right decision given all the data out there? Or conversely, can you make a decision quickly enough, possibly without, or is it the right decision if you miss some of the data? So when you make a decision, no matter what profession you are, you typically go through these 4 steps. You observe the situation around you, you interpret the data. This is data that you see, data that is quite obvious. And then you evaluate based on data that you have amassed from your experience, your education, your training, and finally you decide. So whether you're making a simple decision like whether to take the train or a taxi from the airport, or a more complicated decision like how to investigate a certain drug or a certain cancer diagnosis. You go through these decision making again and again and again. The problem is the interpret and evaluate steps of this are where huge amounts of data get inserted. So how can you possibly make the right decision in the midst of all this information? So what if there was a tool that could help you? What if there was a tool that had the time to read all the information available, that was trained in your field, and you could ask it questions, like questions related to your making decision, like an assistant, like a cyber assistant. And that's what Watson is endeavoring to be. A technology that can read 200 million pages or 14 kilometers stacked up and respond to a question in 3 seconds. So you've got a buddy, a friend, that can read really, really, really quickly, and then you can ask a question. So this is not searching, right? This is actually reading and understanding English, French, Spanish, Italian. Understanding what's a noun, what's a verb, what's the context. So when you ask it, it's actually interpreting. And this is new. This is not necessarily been available before. And the other thing is that it'll learn. So you ask it a question one day, it'll get it wrong, like a child. You teach it, ask it the same question the next day, it'll get it right. But it can do that at computing speed. So learning very, very quickly. And over the course of 6 months, maybe a year, it can become an expert in that field, in lung cancer, in biochemistry, in scientific machines, machine intelligence, and materials. So that's really what we're talking about here. And so, and every industry, we talk about it in IBM and other companies about this cognitive era that we're entering. So how can you afford not to think about this technology and what it can do to your industry? And that's why I'm here today, to talk about that. So 3 key pieces of technology that have come together here to form Watson. The first is that it understands natural language, as I mentioned, and human communication. It understands when you speak to it in natural language, like the way you'd speak to your buddy, to your friend, to your colleague, to your boss. It also is starting to understand images and video. So we're not just talking about text now, but also videos and images, and that has even more applications. The second is that it takes all that and generates hypotheses. If you ask it a question, it won't come back with one answer, but it also won't come back with pages and pages of results. It'll come back with maybe 3 or 4 or 5 answers with the confidence that it has that that's the answer and the evidence to support that. And oftentimes the answer may not be wrong, but the evidence that came back as a result of that question is what drives your discovery process forward. Very important for scientific investigations. And the third is that it adapts and learns, as I mentioned before, from training, from reaction with others, and from the outcomes. So the reason this is important, if I didn't make it clear before, is that this data, 2.5 billion gigabytes of data generated every day, 80 to 85% of that is what's called unstructured, meaning it's text, emails, images, videos. It's not nice data in a database that a typical computer will be able to search and draw a graph from. It's us talking to each other. It's us tweeting. It's somebody blogging. It's a video of somebody at a conference speaking like this. All that is going up there on the internet, being made available. But how can you get information from it? How can you mine it for evidence, for something and make a decision? And that's what we're talking about here. This is an example in the law enforcement field. Police officers have to deal with witness reports, analyst reports, forensic reports, and they don't have time to read through all these. Very often they're making decisions based on one piece of data that they've read, and perhaps others they may have skimmed or perhaps heard from a colleague. They have these meetings where the forensics, the analysts, they all get together in a room and try to share information in order to make the best decision. Sometimes that misses things. So if a cognitive computing technology like Watson can read all these reports and understand them, pull out people, places, connections between people and vehicles, and then being asked that, all of a sudden you have a whole new level of intelligence around the problem and can lead to further investigations. And as I mentioned before, it's a lot of people think about cognitive, and the way that we explain it is, oh, well, isn't that just Siri or like a Google or something like that? The key difference is that we're not talking about keywords, right? So when you enter something like who discovered black holes into a search engine, typical search engines will go and look at those words, the word who. So it's not necessarily interpreting that as, oh, I need to look for a person. It actually looks for the word who, right? The word discovered. Whereas if you put it into a cognitive system that can understand what you're talking about, it realizes that you're thinking of black holes. Perhaps there's some synonyms for black holes that Watson has been trained on, so it'll keep that in its memory. And when you say who discovered, you're looking for a person that was at the beginning of this. And so that's the kind of answer you get. Very different, especially when you start training the cognitive system in the field you're talking about. So as it becomes an expert in law enforcement or biochemistry or whatever, it knows the types of questions you're going to ask, and it'll already have some of that knowledge built up in its system. We actually have been looking at a variety of ways to apply this technology, and here are kind of the 4 patterns of how to apply it. The first is in exploring data. So just data that's already out there, just finding it and bringing it to one place. Just connecting it from different sources, different databases that perhaps were not connected before. Just bringing it all together so that the new connections can be made obvious by having it in one place and doing just basic analytics on it. So that's the first level of cognitive exploration with the data. The second is in engaging. And this is where Watson, or technology likes that, is engaging with citizens, with scientists, with people in a dialogue. So imagine you have a friend that has read all the medical journals that there are on lung cancer, and you can talk to him or her. That's what engagement is. So just being able to get some questions and some answers out of that person. The third is around discovery. So this is where perhaps there isn't an answer for the question. And so you want a tool that can help you go through this process. It's kind of what I showed in the law enforcement example. A tool that can be an advisor, a guide. Have you looked at this? Well, previously in a paper in 2005, this was discovered. Could that be connected to this? So some of those connections that you do in a scientific discovery with your research colleagues. So now a new colleague, a cognitive colleague, becomes part of your team. And finally, the fourth pattern is decision. So this is where Watson's actually helping you make a decision. What treatment should I put on this patient? What investigation should I launch to apprehend this criminal? Where should I go to find the best mutual fund return? That's kind of the ultimate help that cognitive systems can make. And I should point out, this is not machine learning in some sort of unsupervised, out of control manner. This is called supervised machine learning, where humans are always there to make the decisions. So we're not saying that Watson is out there making decisions on its own. It's making recommendations. Ultimately, it's the doctor, the researcher, the detective, the financial advisor, the social worker. That's going to make the decision. But his or her expertise is now scaled and enhanced by this type of a tool. So let me just conclude the last section of my talk here with some potential applications. And I'll say right now, we have not applied Watson to this area, but I'm excited about the potential. So I'll give you some examples that I thought were maybe close. So first, in the area of reading and understanding scientific evidence, we have done some work like this, and I'll show that. Second is, guidance and recommendations, kind of helping make decisions. And the third is watching trends and looking for reactions. We've had some talks already in the session about crowdsourcing, so I'll show a different slant on that technology. So here's something we did. We had Watson watch all the TED Talks. So all the TED Talks are available online, transcripts are available. So Watson watched all of them, read all the transcripts, so became the TED Talk expert. And there's a demo that you can run. And so you can type in very specific questions like who talked about education, blah, blah, blah. Or you can ask more open-ended questions like what is the impact of poverty on education? So Watson will take that, understand what you're asking, and come back with clips of the various TED Talks that talked on this topic and perhaps have some of the answers. So that's kind of TED Talks. So imagine other data, evidence out there that you could sift through very quickly and bring back relevant material. We have developed a tool in conjunction with Baylor University called Watson Discovery Advisor for Life Sciences. So what this does is it takes in chemical databases, textbooks, FDA drugs, and patents, puts it all into Watson. Watson's ingesting this, again, reading it, understanding it. And now you can start to use it as a tool to help guide drug discovery, finding new connections. I'm not a biochemist, so this is kind of above my head, but new connections between proteins and drug interactions, and kind of the effectiveness of these types of drugs and what you would basically discover on your own if you had enough time. If you had enough time to do all of the experiments, to read all the journal articles, you'd probably get there. But instead of taking 5 years, maybe you could do it in 5 months or 3 months, perhaps because you'd have a tool that could get you zeroed in quicker. We also had Watson go to medical school. In fact, this was the first thing that Watson did after we had this Jeopardy game show. I mean, I didn't want to talk about Jeopardy because it's an American thing, right? But that was the coming out party for Watson, was it played this trivia game show in the US, and we wanted to show that a computer could actually beat the champions of this trivia game show because of the way it could understand natural language and make decisions. So the first field after that we went in was healthcare. We took Watson to medical school. We say that, but basically fed it medical textbooks, trained it. Now remember, Watson can read and understand everything, just like I could read a bunch of medical textbooks because they're in English, but I wouldn't understand what they're saying. Nobody would be able to ask me a question about medicine. So it's more than just reading, it's actually training it to teach it what the connections mean, what some of the terminology means. That's what we mean by it went to medical school. And now it's in the field of oncology, advising doctors at Memorial Sloan Kettering Hospital in the US for diagnosis and treatment options. So if a patient comes in with a certain case, a medical record, perhaps it's pretty simple, so you don't necessarily need an expert tool like Watson to help you, but perhaps there's a little twist, something the doctor doesn't necessarily know what to do with. Or what we really want to do with this is put it in the field of hospitals that perhaps don't have that expertise at Memorial Sloan Kettering. Hospitals in emerging market countries, in more suburban or rural areas that can get access to the same level of expertise with a tool like this. So Watson can come back and say, well, based on what I've seen, here's my top 3 recommendations on how to treat this patient. Here's what I think is going on with 80% confidence. If you run this test, perhaps we can increase the confidence. And so in the area of looking across news and trends, one of the ways we've taken this technology is just in terms of social media and all the data out there. So actually, we have a tool called News Explorer that you can all go look at. I typed in EFSA just to see what would come back. This is what came back. You can click on all the links and see what EFSA is related to, what people are talking about with respect to EFSA. Obviously, agriculture, food, rise to the top. But imagine if you train this to be more specific. Like, can I see what are people saying about genetically modified potatoes? And just see what's out there, what it's connected to. Maybe it's being spoken more in Italy than in France. All those connections are possible. The other thing you can do with this, as an extension, is you can analyze tone. So remember, Watson's reading and understanding. So it can detect if people are happy about it or not so happy, just by reading the words and understanding what the words mean. So not only can you say what people are saying, but you can actually start to see graphs of positive sentiment, negative sentiment. So that could help identify trends and where we need to pay attention. So finally, because this is a session on food, Watson also went to Culinary Institute. And what we did is we fed Watson with thousands of recipes and also understanding the interactions between flavors and what types of underlying chemicals go well together. And so there's a cookbook. It's called Chef Watson. And some of these recipes are actually pretty good. Some of them, yeah, not so much. But it just shows you the possibilities, right? So I just wanted to kind of open your mind to what's out there, what we're starting to do in the area of cognitive computing, and I'm excited about the possibilities in a number of areas, including food safety, risk assessment. So thank you.
Yes, thank you very much. Maybe the financial officers in Brussels, they will like it. Maybe they just, take the black box and replace EFSA by that, It sounds like magic. So are there any questions? Yes, please. Far behind.
Thank you. Thank you. Diane Binford, UK Food Standards Agency. I think my head's exploding. Can you say a little bit more about the training process, please? Because you said that one day Watson might get it wrong and the next day he'd get it right, or she, perhaps. Who makes the decision as to when it's wrong and when it's right, and how can you avoid allegations of bias in that training process?
Yeah, so very, very good question. And this is something we've looked at. I get this question a lot. What we do when there's two levels of training for Watson. One is a more academic training that you would do in university, right? So Watson has to learn a field of study. So whether it's oncology, biology, law enforcement, there's more academic study, and that's just looking at more textbooks, understanding terminologies. That's one level of training. And we, IBM or our partners, will do that in conjunction with the customer, so there's no bias there. The second level of training is once Watson ingests data. So let's see now it's trained in the area of law enforcement, but now it's starting to read witness reports, forensic reports, statements from analysts. The training there is done by whatever the customers that we're working with. So in the case of law enforcement, maybe police, detectives, and analysts. And we're going to select, the more we select, the diversity of the trainers we select, the better. So it's not going to be one, it's going to be typically 10 to 12, or however large the engagement is. But it will still be biased towards that particular client. So if I'm working with a police agency in Italy, it's going to have an Italian flavor in terms of how it reacts and how it responds, which may not be appropriate if I take that to France or the UK. And so we would retrain it. So when you have a Watson system installed, let's say with Italian police, I'm just making this up, police authority, you wouldn't take that same Watson and put it in UK. You'd strip it down to that academic training, right? That's pretty common no matter where you are, and then train it again in the UK with more of the specifics of how UK officers respond and react to those types of incidents. So that's typically how we do it. But there's always that opportunity for bias. And one of the things that we have also made available when you do an ingestion of data is you can select and deselect sources and kind of see what happens. So if you think one source is kind of iffy, like maybe you're using Twitter as one of your sources for your investigation, you can turn that off and see what Watson comes back with. It comes back with a different answer. So you can kind of see if some of the sources are less trustworthiness, but still have valid data, you could turn them on or turn them off.
Okay, thank you. I think there was one more. I can allow one more, but please keep your questions for the final discussion, please.
Thank you very much. Could you tell us a little bit about your intellectual property model, please?
So we have, very good question. I mean, we realized early on that this is not going to be successful if we just hold on to it. So we actually, a large part of the business is around our ecosystem. So most of what I showed is available in APIs that partners can take, put together in different ways, like building blocks, and develop their own apps. So we have a lot of partners that are building Watson-enabled tools for everything from, there's a lot more in the food area, to be honest, that people have picked up, but in all sorts of industries, whether it's tourism, areas in automotive, industrial, all sorts of things are popping up, and that's very important for us because it's not going to be, we're not just doing this for, just an IBM kind of thing. It's got to be a whole new way of thinking, and we're talking about it's a whole new era of computing. The only way to be successful, just like the PC, right, is to open it up and let others do it. So that's typically how we're working.
Okay, thank you. Thank you very much. So we close this session and we have another session with one more presentation.